The first thing is probably to define what the menopause is. Now, menopause means your period stops. So technically, it's the time your period stopped. The problem is you don't know that it's your last period until you haven't had one. So if you're over 50, we normally say once you haven't had a period for a year, then you're postmenopausal. Under 50, probably about the same time, but of course there's a bigger chance that you might get pregnant. So we recommend, for instance, that you keep using contraception until 2 years after you've had your last period if you're under the age of 50, 1 year if you're over the age of 50. So there's three main periods, I suppose. The perimenopause is the period leading up to your menopause when your period stops. It probably lasts between 3 to 5 years, often closer to 5 years for many women, and there's a lot of variability. Technically, the average age of going through the menopause is about 51, which means most people are going to go through the perimenopause from maybe in their mid-40s, but of course, at least 1 in 5 people go through it younger. And so you may well be getting perimenopausal symptoms from your early 40s or even in your 30s. But somewhere between 3 and 7 women will get hot flushes, and they tend to be the most common thing, possibly night sweats, during the perimenopause. What we do know is that sadly there's kind of a double whammy here. The longer the time between getting those hot flushes and your last period, in other words, the longer you're in perimenopause, the longer you're likely to have them after the menopause. And we used to tell women that hot flushes would last a couple of years, and now we know that's very different. Actually, it's not unusual for them to last a decade. Probably the average is about 7 years. I think the ones my patients know most about are the hot flushes and the night sweats, and of course they can also disturb your sleep. But a lot of women in their 40s will find that their sleep pattern's changing even if they aren't getting hot flushes, and that can often be related to the perimenopause as well. It is probably easier to list the bits of your body that are not affected by menopause than it is to list the bits that are. They can have impacts on pretty much every part of you. So if you think about it, your hormones, permeate every part of your body, and the menopause is all about your estrogen levels in particular dropping. So mood changes, problems concentrating, tiredness, really, really common, and often women don't connect the dots. Hair loss, getting thinner hair, dry, itchy skin, headaches, joint pains, muscle pains, going off sex, putting on weight, racing heart, all those things I suspect women may not link. And I often get women coming in saying, I think my memory's gone. But actually, although they're worried about dementia, as many as 3 in 10 women, particularly Caucasian women, the study showed, are going to experience memory loss or some memory problems around about the menopause. We need to remember that some women breeze through the menopause. It is not inevitable you're going to go through a bad time, but an awful lot of women have a lot of symptoms, and not just the hot flushes and the night sweats, which can be pretty jolly debilitating even in themselves. But I think the mood changes we really need to think about in particular. That can be completely devastating. These women are often working full time, so they've got a lot on their plate. They may have very responsible jobs. They may have money worries that in turn might cause stress in their marriage. They might be squeezed middle, so they've got teenage kids who are still dependent living at home, and they've got parents who perhaps have needs. So an enormous amount going on in their lives, and then they kind of get all these symptoms on top. So whether it's brain fog, whether it's lack of concentration, whether it's low mood, whether it's mood swings, it can be really, really devastating. I don't recommend that every woman who is going through the menopause comes to see a GP, because some women feel absolutely fine. I would say that if you are having symptoms which are having an impact on your life, then you should contact your GP, and you should certainly tell your GP if you think they may be related to the menopause. If they've started in the last couple of years, or if they've coincided with getting hot flushes and at the same time you're getting joint pains, muscle pains, you're feeling more tired, you've lost your mojo, all of those things. It's really important, if you speak to your GP, that you tell them if you think it's down to the menopause rather than being down to depression. Depression is very, very common. NICE is very clear. It says there's no evidence, that's our national guidelines, says there's no evidence for antidepressants to make low mood better in women who are menopausal and who haven't been diagnosed with depression. They do recommend that you could consider, for instance, HRT, not just for hot flushes, but also perhaps to relieve the low mood that comes with the menopause. And talking therapy can also help. So I think it's very clear that you need to talk to your GP, make it clear to them that you think this may be related to the menopause. And if they disagree, ask them to explain why.